The World Green Building Council, World GBC, is an international network of green building councils that is non-profit. The goal of the World GBC is to produce green buildings for everyone, everywhere, so that people can prosper both now and in the future. The World Green Building Council's global program is Better Places for People, aims to improve health, welfare, and social value across the building and construction life cycle. The initiative fosters industry to leadership and innovative practice while assisting green building councils and their members in transforming health, well-being, and social value at all scales within the built environment.
My name is Melissa ZYREENA binti ABDULLAH. I will explain about the World Green Building Council goal. Uh, the World Green Building Council goal is to achieve climate action, health and well-being, resources and security. First, climate action. World GBC target to climate action is to entirely decarbonize the building environment. All structures will be completely carbon neutral for the duration of their useful life. For both new and existing structures, carbon net features minimize demand by using energy and material more efficiency. Fill the energy gap with renewable source and, and employ low carbon building material and construction technique. Second was health and well-being. Have equitable and resilient building produce health building, community and city. By addressing the social, economic and physical determinants of health in the building environment, the building and construction sector help to enhance public health and well-being. In order to achieve health, equitable and resilient structure, community and city, this entail lowering environment pollution, raising construction standards and quality with a focus on housing and enhancing urban planning. Next, resources and circularity. A building environment that supports resources and natural system regeneration while generating social economy. Advantage through a circular economy. The building environment promotes social and economic benefit by ensuring the safe, ethical, and sustainable production and use of building materials, establishing the positive circle through new business model and practice that prevent resource depletion and pollution and regenerating natural system.
The program that has been made by the World Green Building is the Better Places for People. It is a type of program that could bring some type of reassurance for the people. These Sustainable Development Goals 3 had been followed by the unfinished agenda of the Millennium Development Goals. This is because the SDG has been more advanced in competing for the improvement to fight all kinds of diseases. This program had helped to boost the immune systems so that it could prevent from getting any sort of diseases that still hasn't found the right medicine for it. Other than that, it is to ensure that the standards of the SDG could be met and therefore having the sense of sustaining it. The benefits from this SDG is that it could ensure some type of awareness for the people so that their day-to-day lives wouldn't be disturbed by the uninformed facts. Moreover, the SDG 3 could have been a huge influence for their huge achievement for the protection of the health that was already part of the development agenda under the Millennium Development Goals. This is because SDG had been taking a huge part in helping the society for their benefits of living in a healthy condition.
Subsequently, suggestions for the improvement of the program. The first suggestion for program improvement is to reduce the number of deaths after childbirth by lowering the cost of treatment and making it available to the homeless for free. Goods prices are currently rising. As a result, the cost of treatment will be a greater burden on the homeless. When the cost of treatment is lower or less expensive, it will be more convenient and easier for the family to take them to the hospital when the due date for the baby to be born are near or the mother of child have some problem when giving birth. The hospital government lighten the burden of society with pay RM1 only for checkup. Next, the second suggestion for improvement of the program is to reduce child deaths by creating children's hospitals and giving them more frequent treatment. Children's hospital will be a hospital for children only and the staff will be more focused to them. By building the children's hospital in every state of Malaysia, as we know, in every hospital there are various types of sickness in different age, so it is difficult to focus on one age only. Moreover, in Malaysia there are many clinics for children only at every district. The third suggestion is fighting infectious diseases by creating a health agreement for every country around the world in the event of an infectious disease outbreak. When they have agreement, it will be easier to discuss and unite. Then any of the country breach the contract, it will be trouble for them. For example, the country will be subject to economic sanctions in their country. For instance, before this, we need to overcome on fighting the infectious disease, which is COVID-19. The COVID-19 are still lingering in Malaysia, although we have the vaccine to help boost our antibody. The COVID-19 issue have seen that there are some countries that like to be independent, other that unite with every country in the world. So the fourth suggestion is treating and preventing drug abuse by further tightening the law and creating special organizations to prevent drugs. We can take it to Parliament by enacting it in Parliament, so that the law will secure our country and prevent drug abuse from happening in future. If they violate the established rules and their actions work out, they will get the consequence afterward. After that, we can establish special organizations such as SPRM that prevent the bribe or corruption. This special organization will focus on their own problems so that it will be more convenient and easier for others and not to mix with other problems. In conclusion, health is important in our life. If we sick, it will become a burden to us. Then, healthcare is very important in sustainable development. As you know, in Sustainable Development Goals, there is health and well-being. For example, start at end of year 2019, the COVID-19 started to spread from one country to another, which are from air and physical contact like shake hand, hug or talk. This infection disease is one of the most lethal. As a result, the entire world begins to discuss and band together to deal with it and prevent it from spreading further. We obtained the vaccine to prevent the COVID-19 from becoming worse with the assistance of other countries. This infection disease teach us to be more prepared and work together to combat the disease. Furthermore, countries around the world must ensure people's well-being in order to achieve sustainable development. That's all from us. Thank you for watching our video.